Hi, I'm Mike Hughes. Welcome to Collide Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. Today, our guest is Dr. Joshua Lynch, a board-certified emergency room physician and familiar face in Collide Health's emergency rooms. Dr. Lynch is also the medical director of Mercy Flight of Western New York, an emerging leader on the opioid crisis here in Western New York. Dr. Lynch, thank you for joining us.
You're welcome. Glad to be here.
Tell us a little bit about the opioid addiction here in West New York. Why are so many individuals becoming addicted and overdosing at such an alarming rate?
So this is obviously a huge problem that's really growing and growing very quickly. And unfortunately, the medical profession kind of has a stake in this. And really what has happened with a lot of patients is they have started off with a legitimate prescription for opioid medications or painkiller medications after an injury or a surgery or something like that. And those prescriptions may have been for a week or 2 weeks or even a month, maybe after a surgical procedure or something like that. And what we're learning now is that even just a week or 2 weeks of a prescription may potentially cause somebody to become addicted. So it's really unfortunate that just a simple injury that historically has just healed, these patients are now getting or had been getting pain medications, narcotic pain medications that could potentially cause an addiction. Now, part of the problem is that some of the drug companies had marketed these medications as not addicting. And just for one example, Purdue Pharmacy, who makes OxyContin, you can probably Google TV ads that show the representatives from that company training doctors and telling them that it's not addicting.
Right.
So that's really kind of the beginning of the problem. And well-meaning doctors don't want their patients to be in pain and prescribe them pain medication, which made them feel better. But unbeknownst to the physicians, they could have been creating an addiction problem in well-meaning patients.
So this has been labeled an epidemic, a crisis. Tell us a little bit about, in your work as an emergency room physician, how often you're seeing patients who are addicted.
So I think in one form or another, we're seeing probably a couple a day. And just keep in mind that, so I work with UBMD Emergency Medicine, and we staff 7 hospitals and have about 120 providers. So if I'm just one guy who's seeing probably a patient a shift, just think about how many patients our group is seeing. Think about how many patients Collida is seeing just in the emergency room, not in the clinics, not in the inpatient setting in the hospital. But this is a far-reaching problem, and these aren't patients that just come in that have overdosed. These are patients that come in withdrawal or come in for an injury, and then we discover, like, oh my gosh, you have a pain addiction you have a narcotic addiction problem. So it's the overdose patients are easy to recognize. The patients in withdrawal are a little more difficult to recognize. But the patients that come in with another medical problem, like an abscess on their arm, unless you really pay attention and are very careful, you may miss that patient. And maybe they have an abscess on their arm is because they're injecting into their arm. If you don't spend the time and ask the questions and be patient with them, you may never find that out. And oftentimes these patients want help. Some are embarrassed to ask for it. But if you're proactive and kind of always kind of looking for a problem or a way that you could potentially help somebody, I think our reach is much greater then.
So with a lot of your patients as they come through the emergency room, I'm sure there's a certain demographic you can link them to a certain, based on their illness. Talk about the opioid epidemic. Is there a specific demographic? Can you target it to city versus suburban?
Right.
Talk a little bit more about that.
So really there is no demographic that seems to be more affected by this or not. So we're talking about age, sex, race, socioeconomic status. This problem really does not discriminate across any of those groups. So we have seen at least in Erie County, patients that have overdosed and unfortunately died from early teens, 14, 15 years old, all the way up to patients in their 70s or 80s. So it really doesn't matter, unfortunately. And if you remember, earlier in our talk about how a lot of patients get into this problem, you can think it's not hard to realize that, wow, this can really happen to anybody. So this is not an inner city problem. It's not just a suburban problem. It extends all the way out to the rural communities, all the way down to in the city. And actually, in 2016, the death rate between the city of Buffalo and in the suburbs was about half and half.
So talk a little bit about treatment options. This isn't your typical treat and release type of patient that comes through the emergency room. There's a long road ahead for these types of patients. So talk a little bit about what options are out there.
Right. So, as we have kind of recently learned, or recently has been confirmed that opioid addiction really causes kind of a chemical change in the brain. So this is not something that goes away in a week, or it really isn't something that is cured after somebody goes to a 28-day program out of town and then they come home and the problem is fixed. It's not like that. This requires years of commitment to staying clean, to keeping on the right track, to avoiding temptation. So the treatment options, there's really kind of a lot of treatment options, from counseling to medication to a combination of both, to inpatient therapy programs. Well, what we realize now is that medication-assisted treatment, or MAT is sometimes it's how it's abbreviated, is really kind of the best treatment. So that, in conjunction with a counseling program or some other cognitive therapy, is really kind of where things are effective. So we've been working very hard across the Callida system and really across Western New York, with our hospital partners and really most of the communities across the region, to develop ways to start medication-assisted treatment right in the emergency department or right in the hospital, and get these patients linked up with clinics that have partnered with us that are willing to see patients in a couple days. The other part of the other problem is the clinics are saturated, right? This is a big problem. So, getting patients linked in very quickly is important.
So talk a little bit, you're talking about the treatment options. Talk a little bit about the family network, or the patient's network of support. What do they need, not just from the treatment aspect, but from the social side? Right.
Going to a treatment appointment or a clinic appointment is once a week or a couple times a week. And oftentimes, initially, that's not enough. That's not anywhere close to enough. So these patients really need support from all angles. So they need the physician or the provider support for medication. They need group support around other people that kind of have been through this to try to help them. But they also need family and friends and colleague support too. If you remember, this is a life-changing problem even after they're clean, and they need continual support and continual check-in. So having family and friends and colleagues to be around to kind of make sure things are going good and kind of check in on them, and really kind of hold them accountable to a certain extent, is important.
So a little bit more on the family side of things. Are patients and their families reluctant to talk about it? Admission, I'm sure, is a big issue. Embarrassment, guilty feelings, things like that.
The stigma, I think, is getting a little better. Of this is something that we don't talk about, and I think the media has helped us to a certain extent. The medical profession has helped a lot. Make people realize that this is not something to be embarrassed or ashamed about, or feeling guilty. And if you don't reach out for help, there's a really good chance that you're going to die. Extending kind of discussions to your family or your doctor or to a counselor, and not being afraid to kind of admit, like, hey, this is a big problem and I can't do it by myself, is really important.
So you talked about the threat is real. There's a number of agencies and levels of providers who are involved in this. How do you think the community has stepped up to address this issue?
Well, I will tell you that engaging the emergency department providers really across the region, and getting people who had nothing to do with this before engaged to say, hey, you know what, when these patients come into the emergency department, this may be our only chance to affect them and get them linked with treatment. And on the same note, having clinics kind of say, hey, you know what, we're willing to open up on a Saturday, or we're willing to stay a little bit later. Typically, this that business to a certain extent was a 9 to 5 business, and obviously we know that this isn't a business hour problem. This is happening all the time. So, watching our clinic partners, watching the hospital step up, and really kind of watching the community embrace this to say, hey, like, we got to take care of our own, or we're going to lose an entire generation.
Right. So in a very short period of time, you've become an emerging leader on this issue. What advice do you have for those who may be affected by this or maybe, battling with the addiction?
I think that keeping quiet and keeping to yourself and pretending it's not happening or ignoring signs that you think might be a problem could really be fatal, more or less. And if a family member is kind of noticing that their family member or their friend is kind of not acting right, or really being withdrawn or disappearing for a while, for a day or two at a time, this is the time to talk to them about it and ask them what's going on and not be judgmental. And so if you have a friend or a family member that is battling this addiction, and they seem to kind of fall off the radar, that's the time to reach out and make sure that they have somebody that they can talk with and kind of go to. And even the same with a physician or a nurse practitioner or a PA. If you're seeing a patient and you realize that, hey, things don't seem to be right, this is something that I think it's realistic to ask somebody. And if you ask them and they say yes, you really may have saved their life.
Right. So as we close up here, your advice, if someone needs help, what should they do?
So the easiest way is to contact the Erie County Crisis Service Hotline, which staffs the opioid epidemic hotline, and they are equipped to link patients with resources of what do I do now, what do I do tomorrow. They work with a peer-to-peer network that they can hook you up with somebody to meet you at Tim Hortons or to kind of meet up somewhere, talk on the phone, and kind of help you navigate, like, what do I do now, what do I do next. And don't be afraid to talk to your doctor or your family members. And it's very hard to do this by yourself.
Right. Well, thank you for joining us today. We appreciate your
Glad to be
time.
here.
Thank
Great.
you. Thanks once again for joining us on Medically Speaking. My name is Mike Hughes. We'll see you next month.